Have you ever experienced an unrelenting itch in a specific part of your body? A nagging sensation that just won't quit, leaving you wondering if it's more than just a fleeting irritation? You're certainly not alone. Today, we're delving into a vital subject that could hold significant implications for the well-being of our beloved seniors. The 4 particular spots on an elderly person's body where persistent itching might be a signal that their time with us may be shorter than we hope. Recognizing these subtle cues could be paramount in influencing health outcomes. By staying with us until the very end of this video, you'll gain the knowledge to identify these potential warning signs, comprehend their possible underlying causes, and discover crucial actions to take. So, stick around and ensure you're well-informed and proactive about your own health or the health of those you cherish. Don't miss this essential information. In this video, we are going to reveal 4 specific areas of the body where persistent itching in older adults could be a significant indicator. If you're watching this video, comment "Great!" Pursuing robust health and a long life is a desire shared by almost everyone. While genetics often come to mind when we consider longevity, studies increasingly suggest that our daily habits and lifestyle choices wield a greater influence on how long we live. It's crucial to understand that sometimes, seemingly minor symptoms can act as early indicators of underlying health conditions that could impact our lifespan. For elderly individuals, particularly those over the age of 60, the appearance of continuous itching in specific areas of the body can be a cause for concern. This itchiness might be a subtle yet important message from the body, suggesting a potential compromise to their longevity. It's vital to pay close attention to such persistent symptoms. Now, let's talk about the first crucial itchy spot: persistent, unexplained itching all over the body, especially if accompanied by other symptoms. This might be the most significant warning sign. Take, for instance, the case of Mrs. Jang, a vibrant 60-year-old. Starting in September, she found herself constantly plagued by itching. Initially, she brushed it off as a minor inconvenience, but as the colder months arrived, the itching grew more intense. Despite trying various lotions and ointments to soothe the discomfort, she experienced no relief. Alarmingly, Mrs. Jang also noticed a significant and unintentional loss of weight, which further worried her. Eventually, she sought medical advice and underwent a comprehensive checkup at the hospital. To her utter surprise, the persistent itching she had endured for months turned out to be a symptom of lymphoma. This diagnosis was unexpected, as she had never imagined that itchy skin could be linked to such a serious condition. This connection underscores the vital importance of paying attention to and thoroughly investigating persistent symptoms, as they can sometimes point to underlying health issues requiring immediate medical attention. Lymphocytes, a type of white blood cell essential for our immune system, are distributed throughout various tissues and organs in our bodies. Consequently, lymphoma, a cancer of these cells, can potentially develop in almost any part of the body, even including hair and nails. When lymphoma occurs, the cancerous lymphocytes can release biologically active substances, such as histamine. These substances enter the bloodstream and travel throughout the body, eventually reaching the skin. This ongoing release of histamine and similar compounds stimulates the sensory nerve endings in the skin, leading to persistent and often severe itching. Research indicates that approximately 20% of individuals diagnosed with lymphoma experience some form of skin itching. This symptom is not just a minor annoyance, it's a significant indicator that warrants careful attention. If someone experiences unexplained itching that doesn't respond to typical treatments or medications, it's essential to consider the possibility of lymphoma. This is particularly true when the persistent itching is accompanied by other concerning symptoms. Aside from skin itching, lymphoma can manifest through a range of other symptoms. These can include the persistent enlargement of lymph nodes, a low-grade fever, night sweats, unexplained pain, significant weight loss, and anemia. Each of these symptoms, whether experienced individually or in combination, can provide crucial clues about the potential presence of lymphoma. It's vital to be vigilant about these signs and seek medical evaluation promptly if they occur. Distinguishing between normal itching and itching caused by cancer can sometimes be tricky. However, itchy skin associated with cancer often has several distinctive characteristics. Firstly, it frequently appears suddenly and without any clear trigger, making it different from typical, less severe forms of itching. Secondly, this type of itch is often stubborn and doesn't easily go away with standard treatments or medications. Lastly, the skin might appear visually normal, without the presence of rashes or eczema, and its condition might not significantly change with variations in weather. Recognizing these characteristics can be helpful in identifying the potential seriousness of the symptom and prompting timely medical consultation. If you're finding this information valuable, comment insightful below. Now, moving on, let's discuss the second itchy spot, itching in the armpits. This might be linked to issues with blood sugar regulation. For individuals grappling with diabetes, the challenges often extend beyond just managing blood sugar levels and dietary restrictions. Elevated blood sugar can disrupt the delicate balance of skin nerves and the autonomic nervous system, leading to a series of uncomfortable symptoms. One often overlooked consequence is dry skin, resulting from decreased sweat and sebum production. This dryness can become a relentless source of itching, adding another layer of difficulty to the daily lives of those with diabetes. Furthermore, for individuals who are overweight, the situation can become even more problematic. Excessive sweating in the armpits creates a favorable environment for the growth of bacteria and fungi, further exacerbating the discomfort and itching. This issue tends to be most pronounced during the drier, colder months of autumn and winter, when the skin's natural moisture levels are already low. The itching caused by diabetes can be particularly distressing because it's not always accompanied by visible signs like red patches or bumps. Instead, it often manifests as a persistent, elusive irritation that can spread beyond the armpits, affecting other parts of the body as well. The emotional toll of this ongoing discomfort can be significant, as it disrupts daily activities and diminishes one's overall quality of life. The constant struggle with itching, combined with the broader challenges of managing diabetes, highlights the need for compassionate care and understanding. If this information has shed light on a potential connection you weren't aware of, comment connected below. This time, let's talk about the third itchy spot, itching in the anal region. Itching in this area can be a deeply uncomfortable and distressing symptom, often indicating underlying issues with anal and rectal health. This type of itching is more than just a minor annoyance. It can profoundly impact a person's quality of life. The discomfort might start as a slight, localized itching on one side of the anus, initially causing only minor inconvenience. However, if the underlying condition is not addressed, the itching can escalate over time, becoming a persistent and pervasive problem. The intensity of the itching may increase, spreading to involve a larger area and becoming particularly bothersome during the night. For many, the sensation of persistent itching in the anal area is more than just a physical nuisance. It can evoke significant emotional distress. The constant urge to scratch can be both embarrassing and debilitating, affecting one's ability to concentrate on daily tasks and enjoy a restful night's sleep. Conditions such as hemorrhoids, anal fistulas, rectal cancer, and anal cancer are often at the root of this discomfort. Hemorrhoids, with their painful and inflamed veins, can lead to persistent itching that seems impossible to relieve. Anal fistulas, with their uncomfortable and persistent drainage, further worsen the itching. More concerning are the possibilities of rectal and anal cancers, which can present with similar symptoms but are also accompanied by additional alarming signs such as bleeding, severe pain, or significant changes in bowel habits. The emotional impact of dealing with such persistent and distressing symptoms cannot be underestimated. The effect on daily life, self-esteem, and overall well-being is profound. If you or someone you know is experiencing persistent anal itching that worsens over time and significantly disrupts daily life, it's crucial to seek medical attention promptly. Early intervention is key to addressing the underlying condition, providing relief from the discomfort, and ultimately restoring a sense of normalcy and peace. If you found this information important, comment important below. I believe you're enjoying this video and finding this information truly valuable. Before we continue to our final itchy spot, make sure you subscribe to our channel if you haven't already. Give this video a thumbs up if you're learning something new, and share it with anyone who might find this information helpful. Your support allows us to continue bringing you crucial health insights. Comment wonderful if you're enjoying this video. Now, let's move on to the fourth significant itchy spot, itching in the genital area. This is a common concern, particularly among women, and can be linked to a variety of gynecological conditions. These conditions include vaginitis, vulvitis, eczema, genital warts, and scabies. While itching is a primary symptom in each of these issues, the underlying causes and associated symptoms can differ. For instance, vulvitis is an inflammatory condition that affects the vulva, the external part of the female genitalia. This condition can lead to itching due to an imbalance in the vaginal flora. When the delicate balance of microorganisms in the vaginal environment is disrupted, harmful bacteria or pathogenic microorganisms may multiply. This imbalance often triggers an inflammatory response, which can manifest as itching, redness, and swelling of the vulva. In addition to itching, vulvitis may be accompanied by other symptoms such as pain or a burning sensation. These symptoms can become more pronounced during activities such as urination or defecation, further increasing discomfort. The act of scratching the affected area to try and relieve the itching can also worsen the sensation, creating a cycle of irritation and intensifying the condition. Other gynecological issues that can cause genital itching include vaginitis, which involves inflammation of the vaginal lining, and scabies, a parasitic infestation that can affect the genital area. Eczema and genital warts are additional conditions that can cause discomfort and itching in this sensitive region. Addressing genital itching effectively involves identifying and treating the underlying condition. Proper diagnosis by a healthcare professional is essential to determine the appropriate treatment plan and to alleviate symptoms effectively. If you've gained a better understanding of this common concern, comment genital health awareness below. Let's now discuss our final, and perhaps often overlooked, itchy spot, itching in the lower legs. This seemingly common complaint can sometimes be a sign of hypothyroidism, a condition where the thyroid gland doesn't produce enough thyroid hormones. This hormonal deficiency can slow down the body's metabolism, leading to a cascade of effects, including the drying out of the skin. When thyroid hormone levels drop, the skin can lose its natural moisture, becoming parched, rough, and more susceptible to irritation. The lower legs are particularly vulnerable to these changes due to a lower concentration of sebaceous oil and sweat glands in this area, which normally help to keep the skin hydrated and healthy. The discomfort associated with hypothyroidism-induced itching can be especially noticeable during the dry autumn and winter months. During these seasons, the air has lower humidity, which can further dry out the skin and increase the likelihood of itching. The skin on the lower legs might not only feel dry, but also become scaly, and it might have a tendency to feel cold and appear pale. The sensation of itching might also be accompanied by a peculiar tingling feeling, further amplifying the discomfort. This combination of symptoms can make the lower legs feel constantly irritated and sensitive, creating a persistent and troublesome experience. It's important to note that itching due to hypothyroidism might have distinct characteristics compared to other causes of itchy skin. For example, dry itching can often signify age-related changes, where the skin naturally becomes drier over time. In contrast, damp itching might be indicative of underlying health issues, such as an illness affecting the skin's ability to stay moisturized. If you find that the itching in your lower legs is severe, persistent, and worsens with the changing seasons, it's crucial to consult with a healthcare professional. Addressing hypothyroidism early can help manage the symptoms more effectively, providing relief from the distressing itchiness and improving overall skin health and comfort. If you found this connection insightful, comment thyroid connection below. Dr. Wang, a respected deputy chief physician in the dermatology department at Wangjing Hospital, affiliated with the Chinese Academy of Traditional Chinese Medicine, offers valuable insights into the different types of itching and their underlying causes. According to Dr. Wang, itching can be broadly classified into dry itching and damp itching, each indicating distinct conditions and requiring different management approaches. Dry itching is commonly observed among the elderly and is typically characterized by skin that feels dry and rough and may even show peeling. This type of itching often results from the natural aging process, during which there is a noticeable reduction in the secretion of sweat and sebaceous glands. As individuals age, their skin becomes more vulnerable to environmental factors such as dry weather or insufficient hydration, leading to increased dryness and subsequent itching. The skin's reduced ability to retain moisture exacerbates these symptoms, making dry itching a prevalent issue in older adults. In contrast, damp itching is usually associated with various underlying health conditions, including abnormalities in liver and kidney function, elevated blood sugar levels, and excessive moisture in areas like the perineum and anus. When the liver and kidneys are not functioning optimally, their ability to detoxify the body diminishes, leading to the accumulation of harmful substances. This buildup can negatively affect the skin, causing it to become darkened, rough, and swollen. In some cases, it may even lead to secondary infections such as folliculitis and lymphangitis, which can cause further complications and leave lasting scars. While scratching might offer immediate, albeit temporary, relief from itching, it's not a solution to the underlying problem. Persistent scratching can worsen the situation, causing the skin to become increasingly red, rough, and raised. This damage can lead to pigmentation changes, bleeding, and the potential for secondary infections such as folliculitis and lymphangitis, which can further harm the skin and result in scarring. To effectively manage and alleviate itching, Dr. Wang emphasizes the importance of addressing lifestyle factors. Making changes in daily behavior, such as improving skin hydration, avoiding known irritants, and managing underlying health conditions can be crucial in reducing itching and maintaining overall skin health. How can we prevent dry itching, which is more common in daily life, especially during the dry seasons of autumn and winter? While the elderly are more prone to dry skin itching, even younger individuals who neglect proper skincare can experience it. To help prevent dry skin itching, consider the following aspects. Pay attention to your dietary regulation. Reduce the intake of high-fat, high-sugar, spicy, stimulating, raw, and cold foods. Instead, eat more foods rich in manganese, such as radishes, cabbage, and sweet potatoes, as well as foods rich in vitamins, such as animal liver, carrots, potatoes, and mushrooms. Strengthen skin management by ensuring adequate sleep and avoiding scratching the skin. Wash your face with cold water appropriately to help moisturize the skin. Reduce the frequency of bathing, especially in autumn and winter, and apply moisturizing lotion or cream immediately after bathing to lock in moisture. Make changes to any unhealthy living environments as much as possible. Finally, try to identify the cause of your itching symptoms and avoid those triggering factors. Thank you so much for watching. I sincerely hope you found this video both enlightening and valuable. What was the most significant takeaway or insight you'll apply in your life regarding these itchy spots and their potential health implications? Please share your thoughts in the comments below. Your feedback helps us create more meaningful content for you. If you liked this video, please leave a comment and don't forget to like, share, and subscribe to our YouTube channel for more important updates and health tips. Your support is greatly appreciated. Before you go, be sure to check out some of our other interesting videos on the channel. You might find your next valuable health insight there. See you in the next video.